Bismillahirrahmanirrahim. Dear students, welcome to my lecture number 36. So, in this lecture, we will talk about the basic principle, therapy and nursing process for using adrenergic and anti-adrenergic drugs. The nursing assessment and nursing considerations. A nursing system. Here, an important nursing consideration when administering non-selective adrenergic antagonist. Actually, there are some important things that nurse should be included in conducting assessment, has to be taking an examination. So first of all, you should note down assess for the contraindication or cautions. For example, history of allergy to a drug, heart blocks, asthma, pregnancy or lactation status, where should be checked in order to avoid the adverse effects. Establish a baseline physical assessment to maintain for any potential adverse effects which are already reported in the literature. You should also assess the level of orientation and for any complaints of dizziness, paresthesia, or vertigo to monitor the central nervous system drug effects, which we have already discussed in detail. You should also assess the vital signs, especially the pulse and blood pressure, to monitor for possible axis stimulations of the cardiac system. Note respiratory rate and auscultate the lungs for adventitious sound to evaluate the effects on bronchi and respirations. Monitor laboratory test results, for example, liver and renal function test, to determine need for possible dose adjustment. Serum electrolytes level should be checked in order to evaluate the fluid loss and appropriateness of the therapy, and the blood glucose to evaluate for hyper or hypoglycemia. So this is very important parameters, especially in case of whenever we are going to administer the non-adrenergic drugs or adrenergic drugs, especially to the patient. In nursing diagnosis, here are some of the nursing diagnoses that can be formulated in the use of drug for therapy. Decrease the cardiac output relating to the cardiovascular effects, and effective airway clearance related to the lack of bronchodilating effect, risk for injury related to central nervous system effect, and diarrhea related to, and increase the parasympathetic activity. Implementation with rational, it is also very important. These are the vital nursing intervention done in the patient who are taking non-selective adrenergic antagonist. Do not discontinue abruptly after chronic therapy because hypersensitivity to catecholamines may develop, and the patient could have severe reaction, like, for example, let's suppose if you are taper drug slowly over 2 weeks and monitor the patient. Let's suppose if we are using certain type of medications in order to treat a disease, and after some time we should abruptly stop the drug. So then after that you become unable to control the condition of the patient. Educate the patient about the positive lifestyle changes, diet, exercise, smoking cessation, to aid in lowering the blood pressure. Assess the heart rate for changes that might suggest the arrhythmia. Obtain the blood pressure and various positions to assess for the orthostatic hypotension. You should also monitor the gastrointestinal function and need for increased access to bathroom facilities, and need for increase the fluid intake related to diarrhea. And rational, you should provide the comfort measure to help the patient cope or treat when the drug effect. You should also provide the patient education about the drug effect and warning sign to enhance the knowledge about the drug therapy and promote the compliance. Evaluation should be done. Here are the aspects of care that should be evaluated to determine the effectiveness of drug therapy. You should monitor the patient response to therapy, improvement in the blood level in heart failures. Monitor for adverse effects, for example, cardiovascular changes, headache, gastrointestinal upsets, and liver failures. You should also evaluate the patient understanding on the drug therapy by asking patient to the name of the drug, its indication and adverse effect to watch for, which I have already discussed in detail in our previous lectures. Monitor the patient compliance to the drug therapy, either the patient is follow the medication properly or not. Nursing consideration and nursing assessment for alpha-1 selective adrenergic blocking agent. So there are some important things that nurse should include in the conducting assessment, history taking, and examination. Assess for contraindication or cautions, for example, history of allergy to drug, heart or renal failures, cardiac failures, pregnancy or lactation status that should be checked, and in order to avoid the adverse effects. In order to avoid the AD or adverse drug reaction of these drugs, you should monitor all these parameters, all these conditions which I have mentioned, that the history of the allergy to the drug, it must be under consideration. The heart or renal failure, it will be also under consideration. Pregnancy and lactation. Establish a baseline physical assessment to maintain, to monitor for any potential adverse effects. Assess orientation, effect, and reflexes to monitor for CNS changes related to the drug therapy. Monitor the cardiovascular status like blood pressure, pulse rate, peripheral perfusion to determine the changes in the function. You should also assess, because it's ethical responsibility to assess the renal function of the patients, including the urinary output, to evaluate the effect on the renal system and assess benign prostatic hypertrophy and its effect on the urinary output. You should also monitor the renal and hepatic function test to evaluate the potential need for the dose adjustment, which is also very mandatory. In nursing diagnosis, you are responsible. Here are some of the nursing diagnoses that can be formulated in the use of drug for therapy. Acute pain related to headache, GIT, upsets, flushing and nasal congestion, it should be under investigations. Decrease cardiac output related to blood pressure changes, arrhythmia and vasodilatations, risk for injury related to central nervous systems or cardiovascular effect of the drug. Implementation with rationales. These are the vital nursing interventions which is done in the patient who are taking alpha-1 selective adrenergic blocking agents. Now, what are adrenergic, selective, alpha-1 selective adrenergic, and non-adrenergic selective blocking agent? I have already discussed in my lecture number 30 through 33 and 34 and 35. You can study there that about the epinephrine and non-epinephrine, adrenaline, non-adrenaline, so all these drugs I have already explained in detail. Monitor the blood pressure, pulse rate, rhythm, and cardiac output regularly to evaluate for changes that may indicate a need to adjust the dose or discontinue the drug. If cardiovascular effects are severe, you should also establish a safety precaution. If central nervous system effects or orthostatic hypotension occur, to prevent the patient injury. You can also arrange for small and frequent meals if gastrointestinal tract GI upset and severe, to relieve the discomfort and maintain the nutrition. Provide comfort measure to help the patient cope with the drug effects, and you should also provide the patient education about the drug effect and warning sign to report, enhance the knowledge about the drug therapy and promote the compliance. Evaluation should be done on different aspects of the care that should be evaluated to determine the effectiveness of the drug therapy. Monitor the patient response to therapy, lowering of blood pressure, improve the urine flow with BPH, benign prostate hyperplasia, monitor for ADR, adverse drug effect, for example GI upset, central nervous systems, or cardiovascular changes. So it can be also under investigations. You should also evaluate the patient understanding on drug therapy by asking patient to name the drug, its indication and adverse effect to watch for, monitor patient compliance to drug therapy. So all these are the basic principles therapy, or you can say in simple words, these are the principles of therapy and nursing process for using the adrenergic and anti-adrenergic drug. So if you have any questions regarding my lectures, so you can directly contact me through my WhatsApps. So I'm always available for your services. And thank you student for watching my lecture. Thank you.